Hi all, this is Dr. Chatran Saurabh Mahapatra, consultant interventional cardiologist working in Manipal Hospital, Hebbal, Bengaluru. Today I'll be giving you a little bit insight on the most burning topic, the most prevalent condition of hypertension and how it affects the starting from the young age group to the elderly. What are the causative factors of hypertension? What are the risk factors? And how we can prevent or treat it in the coming years. Hypertension या फिर आप बोलो high blood pressure is the most common non-communicable disease present in the world. Indians are more susceptible for developing of hypertension because of their changing lifestyles, their diet habits, their high salt intake, and it is the statistics are that more around 11 to 25% of Indians are suffering from high BP, and only 50% are detected or diagnosed. So this is a very alarming statistics because we might be harboring hypertension and we may not be knowing it. Most of the patients who are diagnosed hypertension are detected incidentally when they go to a clinic for some other purpose. Secondly, some interesting facts I'm telling you. There is a difference between rural and urban pattern of hypertension. Rural population are more likely to have hypertension, less controlled. Urban part, they are less likely to be having hypertension, harboring hypertension, or getting controlled. Males are more frequently associated with hypertension, but in females, the control of hypertension is better. And the most alarming statistics, only 1/3 of the diagnosed hypertension are under control because of multiple factors. Because our lifestyle different है, हमारा day-to-day lifestyle, the rising tobacco use, rising smoke use, all these things impact the timely control of hypertension. Now, I will be speaking about the patterns of hypertension in different age groups. Hypertension can be detected as early as 6 years to throughout your life. So I will divide this cause of hypertension into 3 parts. That is children and young adults, that is 6 years to 19-20 years. Then young adults to middle age, that is 20 to 50 years, and elderly, that is more than 50 to 65 years. इन सब तीनों में the cause of hypertension अलग अलग रहता है. So let's come to the younger individuals, like children. उनमें बीपी क्यों रहता है? So इन पेशेंट्स में जो यंग एडल्ट्स या चिल्ड्रन रहते हैं, उनका 90% बीपी होता है प्राइमरी हाइपरटेंशन, वेयर देयर इज नो अंडरलाइंग कॉज, देयर इज नथिंग आइडेंटिफाइबल कॉज, ओनली द जेनेटिक्स एंड एनवायरमेंटल इन्फ्लुएंसेस हाइपरटेंशन को प्रीडिस्पोज करते हैं. और जो 10% है वेयर द कॉज इज आइडेंटिफाइड, वो हो सकता है किडनी के कॉजेस लाइक कंजेंटल एब्सेंस ऑफ किडनी, पॉलीसिस्टिक किडनी, एनी एड्रेनल डिसऑर्डर्स, थायराइड डिसऑर्डर्स, heart disorders. ये different factors रहते हैं, different causes हैं when, and it only covers only 10%. बाकी 90% there is no identifiable cause, we call it primary hypertension. Now coming to the middle aged to the younger elderly people, where the causes are ऐसे ही 90% no causes are there, और 10% में थायराइड डिसऑर्डर्स हो सकते हैं, ओबेसिटी, ऑब्स्टेटिक स्लीप एपनिया हो सकता है, निकोटिन, जो टोबैको, स्मोकिंग, अल्कोहल, एंड आल्सो द एथेरोस्क्लेरोसिस वेयर द कोलेस्ट्रॉल डिपॉजिट होता है आर्टरी में, वो एक इंपॉर्टेंट कॉज रहता है. सो ये आ गया हमारे कॉज ऑफ हाइपरटेंशन इन ऑल द सब ग्रुप्स. हमारे प्रीडिस्पोजिंग फैक्टर, रिस्क फैक्टर्स क्या हैं? चिल्ड्रन में रिस्क फैक्टर्स है लो बॉडी वेट, ओबेसिटी इन चाइल्ड, स्लीपलेसनेस, इमोशनल डिस्टर्बेंस. कभी कभी हम छोटे बच्चों को डीकंजेस्टेंट्स देते हैं. लॉन्ग टर्म अब्यूज ऑफ ड्रग्स may lead to hypertension, and in this younger individuals many people are addicted to cocaine, amphetamines or IV drugs, वो में predispose करता है hypertension. So these are the risk factors of developing hypertension in the children. Now coming to the risk factor of developing hypertension in the adults and the elderly group. The most common is the lifestyle, erratic lifestyle, high consumption of salt, obesity, sedentary habitat, consumption of alcohol, smoking. ये सब है risk factor for development of hypertension in the elderly and adults. Now coming to the treatment, how to approach for this patient. हम कैसे इनको approach करेंगे, कैसे treatment करेंगे in each of the subsets. Children के लिए very much important to identify the cause, because उनके symptoms ज़्यादा नहीं रहते हैं. They will be accidentally detected, or when they are getting hospitalized, you will get to know कि they have hypertension. So very much important to identify the cause रिस्क फैक्टर्स क्या हैं हाइपरटेंशन के, कोई अंडरलाइंग डिजीज है क्या, किडनी का इशू कुछ है क्या, एड्रेनलिन इश्यूज है क्या, सो ऑल दिस थिंग्स, थायराइड इश्यूज है तो ऑल दिस थिंग्स के लिए स्पेसिफिक टेस्ट रहता है कि थायराइड का प्रोफाइल करो, कॉर्टिसोल करो, कभी सीटी स्कैन करो, अल्ट्रासाउंड करो, ये सब modalities to identify the cause of hypertension in children and adults. कभी कभी we don't have any risk factors, don't have any identified cause, उस समय we have to concentrate only on changing the lifestyle and medication. This comes for the treatment of hypertension in children. Adults के लिए भी first and foremost is identify the cause of hypertension, detect the risk factors and prevent target organ damage. क्योंकि हाइपरटेंशन पूरे सब ऑर्गन सिस्टम को इन्वॉल्व करता है, मे बी किडनी हो, हार्ट हो, लिवर हो, आईज हो, रेटिनोपैथी करता है, सो प्रैक्टिकली एवरी ऑर्गन इन द बॉडी इज अफेक्टेड बाय हाइपरटेंशन. सो आइडेंटिफाई द कॉज ऑफ हाइपरटेंशन, प्रिवेंशन ऑफ रिस्क फैक्टर्स, करेक्शन ऑफ द रिस्क फैक्टर्स एंड लास्ट आता है लाइफस्टाइल चेंज एंड मेडिकेशन. मेडिकेशन अंत में आता है. फर्स्ट वी हैव टू चेंज द लाइफस्टाइल. Daily exercise like 150 minutes of moderate intensity exercise or 75 minutes of heavy intensity exercise in a week is very much important for prevention of hypertension and adequate control of hypertension. Avoidance of excess salt intake, avoidance of junk foods, less than 5 gram consumption of salt per day is very much recommended for any patient of hypertension or pre-hypertensive patients. High intake of fibers, high intake of fruits and vegetables will negate the effect of salt. Now, and weight loss is very much important because hypertension has been found in 25% of obese patients. So that is also important. Now coming the drugs. Drug लेना important नहीं है, ड्रग को करेक्ट डोज में लेना है, फॉलो भी important है. Hypertension is a very I cannot say non-curable, but it can be preventable and controllable. It's like your second wife. You cannot, you with or without a wish, you have to live with it, but you can keep it under control with identification and prevention of all the risk factors.